In recognition of International Lead Poisoning Prevention Week, themed Bright Futures Begin Lead Free, the Ministry of Health has released two major initiatives to combat lead exposure and to promote children's health. The launch of National Blood Lead Level Survey fact sheet alongside the country situational assessment of children's environmental health report provides a comprehensive overview of lead levels and environmental risks impacting young populations. These resources will inform targeted intervention, driving the nation closer to a future free of lead exposure and creating a safer, healthier environment for generations to come.
Lead poisoning remains a significant public health concern globally, with children being particularly vulnerable to its harmful effects. Children absorb lead 4 to 5 times faster than adults. Some experts in the region even say 10 times faster than adults. Their children are more at risk because they are constantly in touch with the environment, like such as through playing. And as most of the organs in a child are developing, more damages must be happening in a young body. Lead is not biodegradable, for information. Exposure to lead, even at low levels, can cause irreversible health and developmental issues, including cognitive impairment and loss of IQ, intelligence, behavioral disorders, and damage to the nervous system. No level of lead in the body is considered safe. The National Blood Lead Prevalence and Source Survey was conducted nationwide, involving nearly 3,000 children, and preliminary data were also gathered on pregnant and lactating women, and also young children in monastic institutions, and the results are quite worrying. The report provides us with vital insights into the current state of lead exposure in our communities. Ingestion from various sources, ingestion of lead from various sources, and also a picture, some insight of a kind of environment and pollution control mechanisms we have in the country, and also insight into future generation that will lack intelligence and low labor force productivity in the long run, and a spectrum of health hazards that we may face as we move on.
The Ministry of Health and UNICEF calls to action to find comprehensive, multisectoral, and inclusive solution to stop the dangerous effect on lead poisoning and solicit the support of pertinent policymakers to develop relevant policies, regulations, and actions to address the sources of lead exposure. As a national urgency, it must ensure that advocacy, BBL screening, and mitigation efforts become an integral part of Bhutan's border lead risk reduction strategy.
Firstly, I must say that Bhutan is pioneer among the developing countries in a sense that many of the developing countries are yet to do this kind of nationally representative surveys. They have actually focused more on the targeted population where risk of exposure is very high. Ours is nationally representative. Now, when we look at the findings around the world, so first the pioneer is USA, where they have around 2.5% of children aged 1 to 6 with blood lead levels, elevated blood lead levels, which is around 1 in 50 children being affected. And here in Bhutan, it's 3 in 4 children with the blood lead level higher than 3.5 microgram per deciliter, so which is very concerning for us. No blood lead level is safe. No blood in lead in blood is safe. But for our study, the limitation was our equipment can only go up to 3.3 microgram per deciliter. Detect limit is that much. And we took this CDC level of 3.5 threshold, which is actually the reference threshold for action, above which the intervention should come in. So we actually took the lowest possible. WHO's threshold is 5 microgram per deciliter, but CDC had 3.5, which is lower than 5. So we took the lowest possible value that we can look at.
So children younger than 5 and infants are most at risk along with pregnant mothers. And there's a couple reasons for that. Number one, children, the younger they are, they put everything in their mouth. So if there's lead on something, it's going to be more likely entering their body. Secondly, for both children and for pregnant mothers, they are requiring lots of micronutrients to grow. A small infant starts off at just a couple kgs, and by the time they're 5 years of age, they've doubled and tripled their size and weight. And so they need lots of micronutrients. So their body's absorbing a lot, calcium, iron. They'll also absorb lead at a faster rate, 4 to 5 times faster than an adult will. And finally, the lead that goes into small children, there's a covering across the brain called the blood-brain barrier. And until about 5 years of age, it's more permeable and it will allow lead to come into the brain and it permanently deposits there. That's why the risk is so much higher for a small child in the early years of life. So if lead is pervasive across the country, where most of the majority of the people and children were exposed to it, that lead would have gone into the brain and actually made learning more difficult. So over time, they will be less productive because they wouldn't have achieved the same level of higher education. So there's a study by economists from the World Bank that has shown that just the IQ loss will decrease a country's GDP by over 3%, and then the cardiovascular increased costs and risk of death from the long-term effects of lead in adults decreases the gross domestic product of a country by another 5+%. So combining those two, it's over 9% that countries of lower middle income countries and Southeast Asian countries might be losing if they have pervasive lead in their environment.